Hi, everyone. Good afternoon. This is County Executive Pat Ryan. Thank you for taking the time to join us for our COVID update today. In terms of where we're at the high level, I think all of us had at least I know for me, an emotional moment on Monday morning as I watched live at about 9:15 the very first dose of Pfizer's vaccine being administered to a healthcare hero in our home state of New York, which seems to have been the first dose in the entire country. So I felt a great sense of pride that we've moved so quickly on that, and a sense of hope and optimism that I know was shared by everybody watching that and participating in that. So that was a great way to start the week, and I think that is the good news for today and for looking out longer term into the future. But, and I need to caveat that heavily, right now we are very much in this second wave, and the wave is continuing to build and grow and accelerate at a rate and a level that is very concerning, that is much more significant than we experienced in the first wave, and has really continued to worsen in these last 2 weeks. And so I cannot stress enough the urgency that we need to bring collectively to flatten this second curve so that we can get through the winter and get to the point of widespread availability of the vaccine. Some of the most concerning high-level statistics, and of course we'll go through them all in a moment here, the two that are most concerning to me, looking back 2 weeks ago on December 1st, that is the day that we actually crossed the threshold of 1,000 plus active cases on December 1st. So exactly 2 weeks ago, we broke that milestone and surpassed the highest number we'd had in the first wave. In the 2 weeks since, we have almost doubled the number of active cases, and we're now at just shy of 2,000 active cases. So to nearly double that active number in 2 weeks is an important warning sign, another important warning sign. The other, probably most alarming spike is that since our last update, just last week on Thursday, we have seen an over 50% increase in our hospitalizations in Ulster County. We went from 16 at our last update on Thursday to now 25 today. So that is a very alarming spike in hospitalizations, which we unfortunately did anticipate, given that we've seen the total number of cases growing over the last few weeks. Diving in more deeply to the numbers, here are the total cumulative numbers for the county since the beginning of the pandemic. We are quickly approaching 5,000 total cases. We have now tested over 175,000 residents and continuing to amp up our testing capacity, which we'll talk about in a moment. Fortunately, 2677 recovered, and tragically, another fatality over the weekend in the county, bringing us to 112 lives lost to COVID-19 here in Ulster County. And of course, we know nationally, we are now at a level where each day we're having over 3,000 deaths per day in the country, meaning each day in the United States of America, more people are dying from COVID than we lost to 9/11, than we lost to Pearl Harbor each day. And until we mobilize the broad public will to change that, that is a very dangerous place for us to be. In terms of the hospitalization numbers, I talked about this already, but in terms of looking at the graph, we are now at 25, and you can see the beginning of a climb there again of total hospitalizations in the county, projected to continue to grow at the current rate. Fortunately, only 3 of the 25 are in the ICU, which is, I think, very much a reflection of our great healthcare providers getting better at treating COVID, as well as the possibility that the virus has become somewhat less deadly as it has continued to morph and mutate over the course of the pandemic. None of that has been able to be confirmed with any real sense of extensive data, but we are seeing in the county, while the total hospitalizations are up, we don't have as many folks needing to be put on ventilators, which is very good news. In terms of active cases, I talked about this one as well already, but to see it on a graph is quite stark and striking. We are now at 1,905, 1905 active cases. And we are very much seeing significant numbers recover. So remember, this is a number of active right now. Every day, as we add 70, 80, 90, or even more than 100 cases each day, we are seeing dozens of people still recovering, which is of course good. But this is the cumulative number of active continues to grow even as we see many recovering from COVID. And that is what gives us cause for concern as we start to potentially stress our hospital systems and our healthcare systems to a concerning point. In terms of the new infection rate number, again, this is continued concerning and negative news here in the last 96 hours since our last update. We have tested 5,629, 5629, and had 296 come back positive. So in the last 4 days, 296 new positive cases. That puts us at a 5.26% new infection rate. We have now been consistently over that 5% new infection rate for going on 10 plus days. And in the last 24 hours, we were at 6.36%. We know that given the total caseload and that new infection rate, that we have now moved into a place in Ulster County of community spread, where we all have to assume that the ability to isolate COVID to specific microclusters has essentially slipped away from us, and that a significant percentage of the population are now at risk of being exposed, given that widespread spread, unfortunately. The projections for cumulative cases you can see here have all been, unfortunately, sort of moved up. And 2 weeks ago, we said at worst we'd be approaching 5,000 cumulative by Christmas. We're now almost at 5,000, and we're still a week plus from Christmas. In the worst case scenario, we'll be well over 7,000 cumulative cases if we continue at the rate that we're at now. One piece of good news here, while we have seen on the hospitalization side the current hospitalizations go up, I want to give thanks and recognition particularly to Health Alliance, who significantly added to their hospital capacity. So you'll see in the numbers here, we now have really been able to beef up our hospital bed capacity, where Health Alliance brought online multiple more staffed beds within their facility. So we now have a lot more extra room if needed, if things do continue to escalate. Of course, that's not what we want to happen, because that will inevitably mean people are very sick and dying. But if we get to that point, our hospital capacity is much greater. And if we need ventilators, we're still have 33 on hand, which is good news there. In terms of what we're doing to blunt this, again, as I've said for the last month plus, each of our individual decisions really is the only way that we can blunt this second wave and flatten this curve. And I know I'm continuing to sound like a broken record, but we know what works here. We know that it comes down to wearing a mask, maintaining social distancing, washing hands and using hand sanitizer, and avoiding unnecessary gatherings, even of small groups, particularly indoors and particularly in homes. We saw the health department at the state and the governor last week share preliminary numbers showing that nearly 70% of the contact tracing investigations tied COVID spread to social gatherings indoors, whether that was out at a restaurant or largely in people's private homes. So when people ask, what can we do to blunt this, a lot of people ask, why aren't we shutting businesses down? Why aren't we locking things down? We are using the data to drive our decisions, and the data is showing that more and more the spread of COVID is happening at the individual home level and small gathering level. So really the main thing that we can each do is not do that, and remind each other and encourage each other not to do that. If you have to get together with people, even in a small group, wear masks and maintain that distance, and don't think that it can't be spread in those settings. Just like you'd put on a mask to go to the grocery store or go out and about, you need to really do the same thing if you're getting together with anyone who you don't know to definitively not have COVID. Other things that we're doing at the countywide level to try to stay proactive and do everything we can to both flatten the curve and also provide great care to those that are COVID positive. We are continuing to expand testing. I'll talk about a major announcement there in a moment. We've continued to ramp up our health staffing, and we've done a lot of work in advancing our vaccination planning efforts and distribution efforts, and I'll talk about that as well. First off, we've had a lot of questions about expanding our testing capacity, and I hear you loud and clear. Continue to see long lines and concerning wait times on tests. I feel that frustration, as does pretty much every community across the country, where we, due to the widespread number of COVID cases nationally, we just don't have adequate testing and lab resources. So we're doing as best we can to meet that demand, and we're going to continue to push to do that. I want to once again thank Health Alliance and Dr. Doyle and his team. They once again further expanded their hours at the Midtown Kingston testing site, which is run by Health Alliance. And most significantly, they've now added back weekends. So before it was just Monday through Friday. Now every single day, 7 days a week, that testing site is available. You can either drive up to that site, which does require a pre-planned appointment, or you can walk up with no appointment anytime that they are open. So there's both a walk-up option at that site and a drive-up option. And once again, if you are going to do a drive-up, you have to call ahead and make that appointment so that they can get your information pre-entered. But if you don't want to do that or you can't do that, you can walk up without an appointment. And once again, I want to thank Health Alliance. They worked, and our Ulster County DPW worked throughout the last few days and weeks to winterize that site so that even in the cold and the snow, which we're going to be experiencing starting tomorrow, that we can keep that site running, that our healthcare workers can be warm and safe, and that we can continue to maintain that robust testing capacity. We are continuing to press and work with our other healthcare partners to add more testing at other sites as well. So stay tuned for more of that to come. In terms of our vaccination distribution and planning efforts, we're continuing to really lean in here. I've said it before, but it bears repeating. Safely and equitably distributing the vaccine is the single most important and single most difficult operation that we will undertake during the course of this entire pandemic response. And so we are treating it as such and really making sure that we're prioritizing our planning efforts. Yesterday, as I said at the beginning, the very first doses of the Pfizer vaccine were administered here in New York State. I'll put up again the New York State 5-phase framework just as a reminder. The first phase you can see focused on our healthcare workers that are most exposed to patients, our seniors and long-term care facility workers. Those will really be in that first phase, which has just started here this week. Phase 2 will expand into other frontline workers and essential workers and first responders, and then you can see it build over time towards the general population. Many of you probably saw Dr. Fauci yesterday say that he believes by April and May in the U.S. broadly, there will be widespread availability of the vaccine for the general population, which if you look back, the fact that basically we will have reached that point in just over a year, when previously the record was 4 years, I really do think that is a huge credit to our entire public health community, our research and scientific community, and I'm very, very proud that a lot of that work was actually done right here in New York State as well. In terms of what those numbers at the state level mean for us here in the region and in Ulster County, you can see here a map of how those 170,000 doses of the Pfizer vaccine, how they were distributed across New York State. The Mid-Hudson region, which we are a part of, received 19,200 of the doses. And we do know now that by the end of the month, New York State will receive another 346,000 doses once the Moderna vaccine receives FDA approval. We anticipate that that will happen in the coming days and that we will start to receive those doses by the end of the month of December. So zooming down even further in Ulster County, what does that mean for us? 19,200 in the region, but that region includes 7 counties and the very populous county of Westchester with over 1 million residents. So here in Ulster County, we're right around receiving about 1,000 to 2,000 of those doses of those vaccines. They will be prioritized to 2 categories of people, and this work did start here in the county yesterday and today. Our 2 larger hospital systems, Newvance, which is primarily across the river, as well as Westchester Medical System, which includes Health Alliance, both did start receiving those vaccines. They will be administering them to prioritize a list of healthcare workers starting this week. In parallel, our long-term senior care facilities in the county, we have 13 of them. They will be receiving, the workers and residents will be receiving their vaccines through CVS pharmacies have been contracted by the state and the federal government to administer those to our seniors. In Ulster County, at least based on the current plan that we have, those will start being given next week, early next week, we believe, at our senior facilities. So over the course of this week and next week, we'll be administering those Pfizer doses, and then as soon as we get the Moderna ones, we'll have more information about how they'll be allocated. All of these vaccines are part of that, again, first phase focused on our most at-risk healthcare workers and seniors. The other thing that we're doing in addition to the massive logistical operation, which will continue to ramp up with each phase, we really want to make sure that we put in the effort to make this a community-wide and a community-led effort in terms of building trust and confidence that the vaccine is safe and reliable and that everyone is going to have true, equal, and fair access to the vaccine. So we announced last week that we're creating an Ulster County COVID-19 vaccine distribution coalition, and we really want it to be a coalition of members from all across the county geographically, as well as getting all the diversity and the richness of all the communities that make up Ulster County. If you have interest, and I'll talk about who's currently on this committee coalition, but we want to expand and grow this and have as many people as we can participating. If you're interested in getting involved, if you're a leader in a particular community, especially one that might have some questions or concerns or want more information about the vaccine and how it will be distributed, you can actually send us an email. The email is right there on the screen. That stands for Ulster County Vaccine Distribution Coalition, UCVDC, at our normal email address. The initial members of the commission include a wide array of healthcare leaders, community leaders, faith and religious leaders, and other important influencers and voices in our community. It will be headed by one of our most talented and experienced infectious disease physicians, Dr. Mark Tack, who has been absolutely instrumental to me and the whole team here from the beginning of COVID, helping us understand the spread of infectious disease and how we can meet that need. And now heading into this phase, he will be helping us even further, and we appreciate that, Dr. Tack. We'll also include Dr. Woodley from the Institute for Family Health, Dr. Marta Sanchez from the Institute for Family Health, Marielle Fiore from Lavos, Beth Albright at Family of Woodstock, Sue Copenhaver, who heads our county office for the aging, Estella Aquino from New York State Nurses Association, Reverend Childs from the Point of Praise Church, Pastor Denise Younger from the New Testament Church in Ellenville, Diana Lopez from Nobody Leaves Mid-Hudson, as well as representatives from the Ulster County Jewish Federation and the New York State United Teachers will also be represented. And we want, again, to build this coalition and have as many voices. The idea here is that as we get information about how the vaccine will be distributed, but also scientific information about how it works to address any concerns about risk, we will be sharing it with the members of the coalition who can then go out and share that with their communities and make sure that any questions and concerns and needs are being answered and met. So we're excited to see that continue to build. And once again, please reach out if you want to be a part of that. Finally, in case we didn't have enough going on this year and this week, we are in for some winter weather. We already had a little bit of this yesterday, and it's obviously quite cold today. But starting tomorrow afternoon and evening, we will be entering a winter storm watch period here in Ulster County and across the region. You can see the snow forecast map here, courtesy of Hudson Valley Weather, which is my personal go-to favorite in addition to the National Weather Service. Depending on how the storm tracks, we're anticipating anywhere from 6 to up to 18 inches of snow in most of Ulster County. It does look like the further south you are in the region, the more likely you are to see greater snow accumulation. We're hearing from the National Weather Service that given the cold temperatures and the dry air, it's expected to be a more dry and sort of fluffy snow, which is good news in terms of potential impacts on power lines and other critical infrastructure. But we just won't know until the storm hits. And of course, with that much accumulation at up to a 1 inch per hour level or higher, it presents a very concerning risk for driving and being out and about, not to mention the cold temperatures. So please, if you haven't heard of the storm, you probably have, start planning and preparing for that now. In terms of what we're doing at the county, our Public Works Commissioner, Tom Jackson, who's fantastic, has been coordinating the last 48 hours with all of our town highway superintendents and our town supervisors and mayors throughout the last few days. We're going to be working as a team across the county to make sure that any gaps for plowing and road clearing are covered. We know that some of our DPWs and highway crews are impacted by COVID-19 restrictions, and so we're committed to working together to cover each other's backs during this period. Our emergency services and 911 department is coordinating with utilities and the State Office of Emergency Management to ensure that we have all the right resources available as we head into the storm. And if there are any significant power outages, we're coordinating with Red Cross to open additional shelters. We also have our Ulster County Warming Center has been and will remain open 24/7. It's already open now and will continue at least through this week into the weekend to make sure that those that need a warm place to stay are able to access our warming center. Finally, we know that heading into these storms, a lot of people will be doing critical work, but especially our county and town level road crews and plow crews. This is a really tough time for you all, probably with the length of this storm, working 24, 36, 48 hours straight on the roads at a very dangerous time to make sure that the rest of us can be safe and protected and that we can get our roads cleared. So our team here reached out to some of our great restaurant partners, our Project Resilience restaurant partners, and in just a few hours, we had 3 of them step forward and say that they'll be cooking up and providing some great hot meals for all of our road crews and our county DPW workers. I want to thank them for doing that. I want to thank Santa Fe, Dallas Hot Wieners, and Bread Alone. 3 of my all-time favorites have all stepped up and graciously agreed to prepare these meals. So as we head into the storm, you may be hunkered down at home, but like so much of our great workforce, our county workforce, our road crews will be out there in the cold and in the tough weather, driving on some dangerous roads, making sure that we're all safe. So the least we can do is get them some delicious hot food. And I want to thank our restaurant partners and, of course, thank our great team of DPW team and our entire county team for their work on this. On that note, we'll broaden our thanks to all of our frontline workers who have been really there for us throughout this crisis, continue to be there for us, and are going to get us through this last few months of darkness and challenge in the winter before we head into the spring, and finally some signs of optimism and hope around widespread distribution of the vaccine. Thank you for what you've done and what you're doing and putting your community ahead of yourself and your family and taking on that risk. We appreciate it. To each of you watching, thank you for what you're doing. It's going to take every single one of us bearing down for just a few more months here to get through this winter. And then I know that although we'll be tested, we will come out of this and we will emerge from this stronger. And I want to make sure that when we come out of this, we've saved every single life from that we can of our friends and our neighbors and our family members here in the county. So please do continue to take COVID seriously. That's what we're doing here. That's what the science and all the health expertise calls for, and we will continue to do that. If you have any needs, especially heading into this winter storm, you can always call our Recovery Service Center. We'll put the number up on the screen, and it is 845-443-8888. You can also go on our COVID-19 web portal or send us an email. Thank you to our great technical team at Radio Kingston and to Diana Manuel as well for helping us bring this message to you. We will see you for our next update on Thursday at 2 p.m. And until then, please continue to stay safe and healthy, and let's take care of each other and be resilient, and we will get through this.